Hi, I'm Queen Johnson, and you're watching Spotlight. Maybe you're experiencing tingling in your arms and legs. You're concerned, but you're not sure what it is. Could it be peripheral neuropathy? Dr. Wade Verch is with us today. He specializes in the treatment of peripheral neuropathy, and he works with individuals who are affected to help them find relief. Dr. Verch, thanks for being with us today.
Thank you so much for having me.
Yes. Would you tell us, please, what are some of the common symptoms and signs for peripheral neuropathy?
Sure, absolutely. So peripheral neuropathy affects a lot of people. Now, the cause varies from person to person. You know, the leading cause, of course, is diabetes, but not everyone who has peripheral neuropathy has diabetes. As far as we know right now, there's about 140 known causes of it, all with a very similar inflammatory effect on the microvessels that actually feed the nerve. But the symptoms that most people experience here are they'll have some numbness and tingling, typically in the feet, but it can also affect the hands as well. And burning. Some people have a lot of burning, a lot of heat coming up through, a lot of pain in their joints of their feet as well. And it can be very debilitating for people.
Okay, so I've heard that there's medication out there for it. Is it costly, and what are your thoughts on it?
I can't speak to the cost of the medication. Some people's insurances are going to cover it really well, some won't. But the one thing that I've observed in treating this over the last 5 years is that while the medication can take the edge off, it's not curative. And everybody at this point, you know, the medical field agrees with this and they understand it. The problem is there is no magic bullet in treating this thing. That's why we approach this as a process. And there's no medication or surgeries or injections involved in what we're doing. What we're trying to actually accomplish is reverse the genesis of the problem that started it, if that makes any sense. So what we're looking at is the microvascular damage within the feet or the hands. If we can reverse that, we can let the body actually start healing itself, which is why we get the results that we're known for.
And so are there cases where you're not able to?
Yeah, unfortunately we can't help everyone, Queen. So what we do is we screen our patients very carefully to make sure they're in the right place. And while we do our best to help as many people as we can, there is such a thing as it's progressed too far.
Okay, so in the time we have remaining, someone comes in for a consultation, you start to work with them. After how many sessions can they expect to see some type of relief? That's
a really good question. Of course, anytime you're treating a condition, that's going to vary from person to person. But some people start to see the benefit as early as a couple of weeks in. But we do treat people between 3 and 6 months, typically. And our goal with that is to get them as far along as we need to, and then make sure they have everything that they need to keep it from coming back.
Okay, and we're almost out of time, but let me ask, are you offering a special to our viewers?
Yes, ma'am. Actually, if anybody's watching this right now, we do have a $49 special for this Spotlight. What would typically cost $249. This is going to include the consultation, the exam, report of findings, and all the recommendations involved in the condition.
Thank you so much for offering that special to our viewers.
Of course.
Thank you, thank you. Folks, as always, thank you so much for watching. We'll see you again soon on another edition of Spotlight. The preceding program was sponsored by Carolina West Clinic.